Hi, Minister Sgt McKenzie with CTV News.
Hi.
What role do you envision the military playing in the deployment of a vaccine?
Well, first of all, I think the Canadian Armed Forces have been playing a very important role from the beginning. When the start of this pandemic, we knew this was going to take all of Canada effort and a whole of government effort to get the job done. So we've been part of the planning with the pandemic ever since it started. And when it comes to the vaccine rollout, we were already starting work in terms of what role the Canadian Armed Forces will play. We had already started assigning people to start looking at the work, and now as the planning is ramping up, our contribution too will be ramping up.
So can you confirm that the military will be helping deploy a vaccine at some point in time? And at what date can we expect the military to be deploying a vaccine?
So first of all, the actual plan itself, you can understand it's going to be very complex. This is not just about the military. The military is very good at what they do, especially when it comes to logistics. But this is a very complex plan. We need to make sure that this is not just about the Canadian Armed Forces, but it's or the federal resources, but how do we work with the provinces as well? And we will all come together with the appropriate plan to making sure that things are rolled out well. At the end of the day, and plus the timing of it, those are things that are going to be dependent on when the vaccines become available. But as the plan gets worked out by the experts, we'll have better.
But yes or no, is the military going to be involved?
Well, I said the military's been involved right from the beginning, right? So we've been involved with the planning from day one when the pandemic started. We already knew that the only way out of this pandemic was a vaccine. So not only our government invested significantly to making sure that we had all the appropriate vaccines, but we knew that we eventually had to roll it out. So we've been part of the planning for some time now. So now that the planning is ramping up, our contributions too will also ramp up as well, and we'll have more to say when we start finalizing things as well.
All right, we'll try to take a question on the phone. Opératrice, est-ce que nous avons une question au téléphone pour le ministre Sajjan?
Thank you. The first question is from la première question est de Ryan Tumulty, the National Post. Please go ahead, à vous la parole.
Yeah, sorry, I was hoping to ask a question to Mr. Hajdu.
Okay. Any questions for me? Are we good? Okay.
Sure.
Nope,
yeah.
sorry.
My name's Chris. I'm with Canadian Press. I'm wondering, we saw that the Prime Minister apologized for the gay purge in the military. I'm wondering why yourself or the Prime Minister hasn't apologized to the victims of military sexual assault and harassment.
Well, first of all, this is an issue that we have taken seriously from day one. In fact, we've been trying to root this out aggressively, making sure that, first of all, for example, we give the rights to victims. Bill C-77 was just that. Also take action in making sure that things are investigated, holding leaders to account. This is something that we're taking extremely seriously, and rest assured, we're not going to stop until we get the appropriate cultural change inside the Canadian Armed Forces that allows everyone, especially women, to be able to succeed in an environment that feels safe and reach their highest potential.
Speaking of change, can we expect to have a new Chief of Defence Staff appointed by, say, the end of this year?
I can assure you that there is an appropriate process for this, and the Prime Minister will make the announcement at the appropriate time. Okay, thank you.
Today, the German health minister announced that on December 11th, the plan in Germany is to roll a vaccine out. Obviously, the U.S. has made it quite clear that emergency authorization in the States will come fairly soon for vaccines done there. Are you concerned that Canada will be potentially many months behind other Western allied countries in the deployment of a vaccine?
All of our departments are working right now, round the clock actually, on making sure that we have a concrete plan with the provinces and territories, that we are ready to deploy the vaccines as soon as they arrive on Canadian soil, and I'm confident that we'll be able to do that.
So as soon as they arrive on Canadian soil, meaning as soon as they show up here, they will be available and ready to go to Canadians, or is there going to be a situation in your estimation as the Minister of Health where we could be waiting in a regulatory delay for Health Canada to approve vaccines despite the fact that other allied countries may have approved them earlier?
I can't speak to allied countries' regulatory processes. I can just speak to mine, and I'll tell you this. We have an interim order that allows for a very rapid review of the data that's coming in from the vaccine manufacturers. In fact, all three leading vaccines have submitted to Health Canada for rolling regulatory reviews, and we have the ability to provide an interim order to use those vaccines once we're satisfied that they're safe for Canadians, and that's the work that the department is doing right now.
But I just want to follow up. As soon as they arrive on Canadian soil, that's news if you said that. So as soon as we get them, people are going to be able to have access to them?
We're working hand in glove right now with procurement across the whole of government, actually, to make sure that all of this is happening in the order that needs to happen so that we can get the vaccines out rapidly to Canadians. Yes, the manufacturers want to ensure that there is a plan, in fact, to distribute those vaccines, and so we're working with the pharmaceutical companies as well to satisfy their concerns or their thoughts about how this needs to be handled. In the case of some of the vaccines, as you know, have very specific criteria about how to handle the vaccines and how to transport the vaccines. That work is underway. We'll have more to say within days to Canadians about the overall plan, and I'm very confident in the work that the government is doing.
We'll try to take a question on the phone. Opératrice, est-ce que nous avons une question au téléphone?
Thank you. The next question is from, la prochaine question est de Ryan Tumulty from National Post. Please go ahead, à vous la parole.
Yeah, Minister, thanks for taking my question. Two of the provinces that were in the Atlantic bubble announced that they were pulling out of it today and putting in travel restrictions between them and other provinces. I'm wondering if you think that's a setback in terms of the way the pandemic had progressing. I know the Atlantic bubble had been working very well for most of the year.
I have spoken with Minister Haggie of Newfoundland as recently as this weekend. In fact, there is a growing concern about the importation of cases from provinces and territories that are seeing rapid growth in their numbers, and they are taking the steps they feel necessary to protect the health and safety of their citizens. All provinces have the responsibility to protect the health of their citizens, and the federal government has the responsibility to support them in making sure they have the resources they need to do so.
And just as a follow-up, the Atlantic provinces are making this move today to restrict travel. Even as they're doing that, international flights are continuing to arrive in numbers in Canadian airports. I'm wondering, as provinces make some restrictions in their jurisdictions, have you thought about making further restrictions on inbound travel to Canada?
Well, the provinces and territories are very supportive of the approach that we have right now, which is the mandatory 14-day quarantine for any non-essential travels. In fact, it's demonstrated a very low rate of importation, and we have worked extensively with provinces and territories to make sure those quarantines are being followed. I have not heard an expression of concern from provinces and territories that quarantines are not being followed. In fact, they are reassured by the fact that they have the tools to enforce those at all levels of enforcement, and we're continuing to work with them as well. We've made the ArriveCan app mandatory, which is another step to make sure that we have smooth transfer of information to the provinces and territories, so they know who needs to be in quarantine in lifetime, with the ability to transfer that data very quickly.
We'll turn back to the floor. CBC.
Hi, Minister Hajdu. Vancouver's mayor told my colleague Catherine Cullen that you would be in favor of the city's bid to decriminalize the simple possession of all drugs. So could this be a reality in the spring?
So I'm looking forward to the deliberations of Vancouver City Council. I think it's Thursday, their vote. I've been in close contact with the mayor over the last little while, talking about the motion, trying to understand from their perspective what the particulars of that motion might look like. Certainly, I've remained open to supporting provinces, territories, and in fact local municipalities with the tools they need and they think are appropriate to combat problematic substance use, including opiate overdose, and I remain ready to have those conversations. I've committed to the mayor. I'll connect with him after the vote on Thursday.
So did you tell him that you're supportive of this? Because he did tell my colleague
I have told the
are.
mayor that I'm supportive of working with provinces, territories, and municipalities to look at tools that they feel are going to be useful in their fight against opiate overdose, and in fact to support healthier lives for people who use substances problematically, and I will continue that work. This has been actually not just a piece of my work as Minister of Health, but certainly something I've worked on for most of my professional career.
Okay, thank you.
Try to turn back to the phone for another question. Opératrice, est-ce que nous avons une autre question au téléphone?
Please press star 1 at this time if you have a question. Veuillez appuyer maintenant sur étoile 1 pour poser une question. There are no further questions registered at this time. Nous n'avons plus de questions pour le moment.
Hello, Chris Reynolds, Canadian Press. In hotspots around the country, there's been some criticism that big box stores, large retailers can stay open, small shops, entrepreneurs have to close their businesses. To what extent is this an injustice, and can it be combated not just with the tools the government has laid out so far, but for example with requirements that big box stores not sell certain items so that small businesses can be the ones that vend those?
Listen, in terms of deciding which sectors or what kinds of rules are applied at the municipal and provincial level, that is fully within the jurisdiction of the local and provincial public health authorities. And I think, from my perspective, it's guided through the lens of trying to reduce people's mobility and keeping people focused on getting their essential goods and services, but not spending a lot of time socializing outside of the home. We know that mobility is what's driving the increased spread of viruses. So people are making decisions based on the data that they have, their understanding of their communities, and what likely is going to help people stay put and hopefully decrease the spread of the virus.
Building on what David was saying about Vancouver, is the Vancouver approach thus far to opioids and addiction and drug use, is the relative indifference to the criminal, to criminalizing, treating behavior that is technically criminal as criminal, is that approach something that other cities might wish to emulate, or provinces, or something that the government would really get behind?
I think for Vancouver and, in fact, the province of BC, increasingly over the last 2 decades, they've been moving towards a lens of supporting people who use substances to access health services and treating problematic substance use as a health issue. Of course, there's a whole other side around enforcement and criminalization of people who traffic, and that is an entirely different conversation and appropriate, in my mind, to continue. But I think the work of the City of Vancouver over the last 2 decades, and the province, in fact, has been to reorient the conversation about people who use substances and rooted in compassion. Most of us in our lives will identify with having a loved one, or even sometimes ourselves being people who have struggled with problematic substance use. And you know, we know that when people can reach out for help, and when we can reduce stigma for people who are using substances, there's a better chance, A, that they'll stay alive, and B, that they will get the help they need. And so from my perspective as a Minister of Health who has a profound respect for people who use substances, I think the more that we can do to tell people that use substances problematically, that they matter, the better our societies will be.
Thank you.